we would do was reintroduce ourselves, just a little, with a little context about what brought us to the project we're going to be talking about today, which is, we call it Same Fame, and it's self-advocates and family advocates as medical educators. Self-advocate is a term that we tend to use in our center and in a lot of organizations that work with people with intellectual and developmental disabilities, for a person who has an intellectual / developmental disability and is advocating for themselves and others. And we're also going to be using people first language, which is still, in the groups we're working with, the preferred term. But not, this is identity first language is certainly making inroads. And so, but we're going to be using people first language today. Dee, would you like to introduce yourself and talk a little bit about what brought you to this project? And I think your mic is out, Dee.
Yeah, my little dog was barking. Sorry.
No problem.
I am Dee Banta, and I'm a person with intellectual disabilities, and my disability came a lot later in life. I got encephalitis and almost died, and it hit the lining of my brain, which caused seizures and a whole lot of other health things. And so I went through a lot of problems, even with mental health, because I didn't feel like I fit in to the world anywhere. And so I became involved in this is very dear to my heart, because I've had a lot of problems with medical doctors not treating me as a person, and just wanting to, like, oh, there's nothing wrong with me, or I am nuts, I am crazy. So, and like with what you're talking about, Susan, the tables, I was in a wheelchair once, and they wanted to put me in a room that was so small I couldn't even get in the room. And so there's no, I understand. So this is very dear to my heart.
Right. And my name's Ellen Banister. I'm the secretary of the Alliance for Disability in Healthcare Education. I'm also a parent. I'm one of the few non-healthcare providers or faculty members in the Alliance. And what brings me to my current work as academic programs coordinator at the University Center for Excellence in Developmental Disabilities, the Center for Learning Leadership, is really my experience of being a parent. So I have two sons who are now 17 and 13, and my boys are on the autism spectrum and have pretty high support needs. But my younger son, Elliot, was born with Pfeiffer syndrome, which is a rare genetic disorder that has meant that from about age 4 months to maybe 11 years, he probably had 1 or 2 brain or skull surgeries every year. And so we've had a highly medicalized life. We've spent a lot of time in hospitals. We've spent a lot of time with specialists. And Elliot he has no spoken language. He's learning to communicate with an iPad. Supporting my children in that situation, in these medical situations, has been a challenge often, and it's made me really passionate about working on these issues, especially for when my kids get older, because I want them to be, treated with as much respect and care as possible. And so what we'd like you guys to do today is a couple of things. We want to talk about levels of participation of people with disabilities and family members in developing healthcare education. And so we want to talk about participation versus partnership. And so, Dee, what does partnership mean to you?
Partnership means that where people come together and are at the same, oh, Ellen, I just went blank.
The same level?
Yeah, but this is where they work on it in the beginning and they have the same outlook of where they want to go.
Right. And I would say, for me, partnership is really just as Dee says, right? Having people there from the beginning and having stakeholders there at the beginning, and being able to talk to each other and learn from each other. And so for us, having people with IDD, family caregivers, faculty, healthcare students, those stakeholders there together at the beginning is important. And so we're going to be talking about the project Same Fame that we worked on, and a little bit about how it's going. And then we have a few slides here that we did a presentation at the Nexus Summit on interdisciplinary studies. And we on Same Fame, and we worked with Mark Fisher from the College of Nursing. And so we've stolen, these are some of the slides from that presentation that we did. And these are Mark's wonderful slides. He's a really interesting thinker about interdisciplinary work. And so we'll try to do justice to them. So family-centered and patient-centered and family-centered care. Sometimes people think about this as just a pediatric issue. For patients with IDD, their families may continue to be more involved throughout their lives than would be typical otherwise. And so the patient has to be there, the family should be there. And part of patient and family-centered care is collaboration among patients, families, and providers in professional education. And this is a diagram that Dee and I both like, so we thought we'd include it here. This is from the Josiah Macy Foundation and talking about partnership. So what do you like about this diagram, Dee?
I like it that it shows that everyone is involved and somewhere we're going to connect and we work together and we get the outcome.
Mm-hmm. Right. And I like the way it shows this, the education reform as part of this effort, and that clinical practice reform, patients, families, communities, that working together. So we have problems with silos, right? Bringing this all together, I think, is important. And then this is another great Mark slide. And this is, I know some of you guys have gotten PCORI grants. Show of hands, anyone here gotten a PCORI grant? PCORI stands for, and I'm going to read this, Patient-Centered Outcomes Research Institute. And one thing that they do that I think is really nice is when they're talking about research, they've identified engagement levels, right? That the first one is just where you're giving information, right, to stakeholders. The other, consult, you're in dialogue. Third, you're in collaboration, you're deciding and acting together. And then finally, stakeholder directed initiatives, where stakeholders are identifying and leading initiatives. And so this is where we would like to be. And we don't always achieve it, but this is where we would like to be. And I know Ryan McGraw, I know, is on the call from Access Living. And I was so excited to hear about their work because, you have groups of advocates going and talking to medical schools and saying, hey, these are needs we've identified. And let's work together to build curricula. So Same Fame in particular, we you know, we've seen a gap in healthcare education that we all know about. We want realistic simulation activities. And we wanted for people with IDD and family caregivers to be involved from the very beginning, and we wanted everyone to be paid. So Dee, you've been here from the beginning. So what are some things that were important to you when we started this project?
It was very important to me to work on it where to help doctors and nurses, well, all medical field, to help understand that people with intellectual disabilities and all disabilities have rights, and that they should treat them as a person. They should have tables, they should have rooms, they should spend enough time with them.
Right. So there are a couple of projects that we had at our center where we had sort of been building on some of these ideas. And one of them is OKSAN, the Oklahoma Self-Advocacy Network. Want to talk about that, Dee?
Sure. That is where we do trainings, and it is people with intellectual disabilities came together, and we said that we want to learn to do it ourselves, to teach us to do it ourselves. So we had to have believed in us, and so we formed a OKSAN, and so then we started working on trainings, and we do SALT, which is self-leadership, self
Advocate leadership.
advocate. I always forget my advocate. Leadership training, and then we have bullying. We have
taking care of your
health.
yeah.
Which this the spring of this, Ellen worked with us on that, and then we're working on a new one, and so
on sexual health.
Yes.
Yeah. So these are peer-to-peer trainings, right? Developed by people with disabilities. And it was the springboard for Same Fame, right? Yeah. And so we were sort of trying to figure out, looking for opportunities to do this. And at the time, the interprofessional education office at our university began looking for courses to build and offered seed grants, which we pursued. We developed this course, and now we have just started offering this as a monthly elective for small groups of about 10 to 16 students at a time. So here's a little bit about it. This is how we developed it. And so to develop it, we used a very collaborative approach, and this is the process that we use in OKSAN as well, right? This where we start with the thing that we start with the committee, and we decide what we want to do, right? Then we break it down into objectives, and then we decide how that's going to go down. And so we were going to create, after we created what we wanted to teach, we created 2 simulations. We originally were thinking of 1, but then there were so many issues that we decided to do 2. And so Hunter and Terry and Morgan and Pat are 2 scenarios for a self-advocate and a family caregiver to work on. So we piloted it, and this is what we came up with. So it's there is about 4 hours of online material. It uses a team-based learning format. And then there's a 3-hour right now virtual event where teams of interdisciplinary students come in. We break off, we do, one group goes off and does one scenario, one goes off and does the other. And then there's a presentation, a debrief, feedback, and reflection section. And this is a little bit of what it looks like. We are collecting material for a MedEd portal submission. And so all of this, if you guys are interested, the whole course packet and all the exercises and everything will be, we hope, published in that at the end of the year. And so our schedule. And we have just begun evaluating, getting our evaluations for this year. And so we don't have a lot to present. We just did our second session, but we did want to talk a little bit about this issue, which came out as, you know, that the majority of students agreed that it was very important that a person with real life experience play the roles in the simulation. The two stories are drawn from events that are very common in the lives of the, you know, the people who put them together and or their friends. And so there are a lot of things that resonate. But this is from one of the reflection papers. Having people who acted out their role was a big surprise for me. It almost felt like a real-time situation with a patient, and interactions also felt that way. The team was able to provide input based on their respective professions and come up with a plan for Morgan, our patient. This included students from nursing, pharmacy, and medicine. And I realize we haven't gone over the scenarios, but if you guys would like, I can put the 2 assignment sheets in chat so you can take a look at them. There are very detailed backstories for both of for the patient and the caregiver, and so we've spent a lot of time working on those. And so Dee was absolutely great as Hunter last time, but we wanted to spend a little time talking about if you want to do something like this, the supports that are going to be needed to make it happen. And so let's talk to some of these issues. So first, there are complicated university bureaucracy issues that make it hard to get self-advocates and family advocates paid. Does that resonate with you guys? Yeah. So what's been the experience so far, Dee?
It's just so hard.
Yeah.
I know I'd done one thing and it took like 4 months before I got paid.
Right.
Sounds right.
Yeah, it's slow, it's cumbersome, and it has a lot of steps to it. And so we also, you can't give direct guidance for invoicing and some other issues if you're running the project. And so we've found having a community partner who is designated to help people.
I am so sorry.
Oh, you're fine. It's a little, yeah, we're doing this from, many people are from home. So a little cat, a little dog barking. Yeah. So finding some community partner to help people with this paperwork is important. I offer a refresh session before each session so everyone can practice, and we allow additional time to practice. We have talking points that are very in large font and simple language. The stories themselves are in simple language, but we have a list of talking points and we go over those every time. You need to support people with technology. Since this is all on Zoom, a lot of people can do a great job, but they really struggle with getting on Zoom. And so realizing that that's a need and that you may be out delivering laptops, setting up microphones, getting cameras in place is important to know, or making sure that they have an adequate internet connection. You need to recognize that the material may be emotional for participants and respect those feelings. Right. So in one practice, we realized that Morgan, in one of the scenarios, Morgan is in the hospital when their mother Gloria dies unexpectedly, and they have to deal with that situation. And it's misinterpreted as a psychotic breakdown by the by the people in the, and they're put in a behavioral health unit. And that source material was so close to the person's experience that they were just like, no, and so they are assigned now to do that other role. But a lot of emotions are brought up by acting out these roles. And, because it is so close to the lives of many people with disabilities and caregivers, you may be triggering people. And so you have to talk it through and give them a chance to debrief as well. You need to communicate in more than one way. So you may be sending out information in email, in printed form, over the phone, over text, over multiple calendars. And so you need to be clear about how people are going to be able to get information. You need to have paid understudies, and you also need to lure faculty in to shadow and watch and bring their students, and so they can possibly participate in the facilitation as well. Anything we need to add to that, Dee? What has helped or hurt in this process for you in getting started and doing this?
I would have to say just having the time, getting on, like you said, it's not always as easy as one thinks as getting on Zoom. The other day, my internet decided it didn't want to work. So I had to punt and use my phone. So thankfully we were able to get me on in time, but it's crazy.
Okay. Well, I think that's all we got. So I wanted to thank our academic partners and give a special shout out to Lori Sylvester from Allied Health, who's a physical therapist, who is, another partner in crime in this, who we need to shout out. And I almost got here today, but not quite. And then here's our steering committee. As you can see, a lot of people were involved. Okay. So, okay. Questions? Comments?